First of all, everybody, good afternoon and a very warm welcome to today's online event, which is marking the official launch of the Data Saves Lives Germany Kompass. I'm Louise Baker-Schuster. I'm a Senior Project Manager at the Bosch Health Campus, and I'm very pleased to be your moderator for this session today. We're going to dive into the presentation and the discussion in a moment. However, there are a few housekeeping rules that I would just like to make clear. So the session is being recorded and will be made publicly available after today's session, including on the DSL blog and social media. So if anybody does not want to be seen, then please feel free to turn off your camera. Questions can be raised via the hand raising function or directly in the chat. And we would ask you to kindly keep your comments brief and on topic. We want to avoid so-called jellyfish moments, so any unnecessary digressions if possible, so that everybody who would like to make an input can. And if necessary, we will gently steer the discussion back to the topic. You have been warned. So we're looking forward to a very constructive, respectful and lively discussion with hopefully a variety of perspectives. So how will the next hour look? I will briefly introduce our guests in a moment, and then Birgit will introduce the Data Saves Lives Germany Kompass officially, from the history and to how we got to where we are today. And after that, we'll then move into a discussion with our panelists and, of course, with you, our lovely audience. And the idea is that we really would like to have an interactive discussion. So please do feel free to put your hand up or put a question in the chat. The Data Saves Lives Germany Kompass is a brand new interactive tool, and it's designed to help people navigate the complex landscape of health data in Germany and beyond. So whether you're a patient, citizen, professional or policymaker. It aims to shed light on how data is used, where and by whom in research, care and public health. At its core, the Kompass is about building trust, because we know that health data can save lives, but only if it is handled responsibly, transparently and with clear communication. And that's exactly what Data Saves Lives stands for improving understanding, encouraging dialogue and empowering people to engage with the topic of health data. Today's launch is the result of a great deal of hard work driven by people who deeply believe in the power of informed societies. A very special thanks goes to Birgit Bauer, founder of Data Saves Lives Germany and the initiator of this very important project. Thank you for her vision and dedication in making this resource a reality. Thank you very much, Birgit. We're thrilled to have an outstanding panel with us today, bringing a wide range of perspectives from patient advocacy and health informatics to ethics and digital innovation. So please join me in welcoming Professor Oliver Orpitz. He is the head of the Bosch Digital Innovation Hub at the Bosch Health Campus, with deep expertise in data infrastructure and clinical systems. Professor Judith Stafford is president of the Rheuma Cura Foundation, a patient expert and freelance consultant focusing on research, digitalization and AI. Professor Stephanie Scholz is Professor of Data Science in Social Economy at the SRH University Campus Fürth in Germany, focusing on the societal and ethical dimensions of data use. And joining us from the UN city in Copenhagen is Professor Georgi Chaltikian, Professor of Digital Health at the Deggendorf Institute of Technology, advisor to the WHO and a leading voice on the global digital health transformation. So welcome everyone, and welcome to our panelists, but also welcome to everybody who's joining us online. And I think with that, I'm going to hand it over to you, Birgit, so that you can launch the Kompass officially.
Thank you very much, Louise, also for your kind words. It's always great. And as I said before, it's going to be a little bit red in my face because I'm proud of that. Thank you very much. So it's my pleasure to welcome you all to the launch of our Data Saves Lives Kompass. This is the new Data Saves Lives magazine, and Before we start to go a little bit deeper into the Kompass, I want to tell you something about Data Saves Lives Germany, as not everyone is familiar with us. So I want to give you some information about us. Data Saves Lives Germany, or short DSL-DE, is a non-profit project that is co-designed by patients. That means every offer is also dependent on fundings and donations, but we do our best to make things possible. Data Saves Lives Germany was first presented in Germany by myself in November 2022 with a little funding from the Ministry of Health in Germany in Berlin. And we received it in September and had rushed through all those English language materials to do it in German, translate and bring it also into a shape for the German audience. Our goal was to provide patients and citizens with reliable information on health literacy and digitalization in healthcare, and also to support patient organization. But for us, it is important we don't see ourselves as a patient organization or want to replace them, but as an independent information initiative open to anyone who wants to make health knowledge accessible. Our content and services are accessible for everyone and at all times free of charge. This is important because we know also that a lot of people living with chronic diseases, for example, have not enough money and they shouldn't pay for something what can help them to grow their quality of life, for example. We work independently and objectively with trustworthy sources and a number of committed partners. And since August last year, 2024, Data Saves Lives has found a new funder, the Bosch Health Campus. And we are very happy with that because this is not just having a new funding and budgets for doing our stuff. It's also to have a partner who is really committed to digital health and data literacy and helps us also with information or also with other sources we need to do our work. So thank you for that too. About myself, I'm a social entrepreneur. I'm an expert speaker, journalist, and strategy consultant in the field of digital health. I'm living myself with multiple sclerosis for more than 20 years now, and I'm an active patient expert. I'm working on an international level, specialized in communication for patients, and I'm also a proud fellow of the CISIANA, the Health Leaders Network. And I enjoyed that time very, very much. I was in cohort 5, and it was for me a great experience as I learned a lot also about health leadership. And I think this is a great opportunity for everyone because we need that. In 2019, let's step a little bit more into the past. Data Saves Lives was founded by the European Patients Forum, the European version of it. And I was appointed at this time to the editorial board of Data Saves Lives Europe. In this time, I researched, I designed, I learned, and I always had a clear focus on communication and digital literacy, also health literacy. After an intensive analysis, it was clear for me that Germany needs an own Data Saves Lives. I would say a customized one to make also or to give the opportunity to the German patients and also citizens to learn more about health data sharing and so on. In November 2022, it came into reality, and it was as a patient-driven initiative that focused on cooperation, comprehensibility, and trust. And we are working, as I said, as a non-for-profit initiative. Today, Data Saves Lives is considered as a reliable source, even also internationally with reach extending to North America, to Canada, where our content is recognized and shared by experts and patient organizations and, of course, patients. What I said before in the German session is we make a difference. We make voices of people living with illnesses and voices of citizens heard even on a global stage. So we try to listen and we give as much information, or we share as much information about our learnings with other partners to make the situation sometimes a little bit more easy, because we all know health is a complex theme. The idea about the Kompass itself, Data Saves Lives, to be honest, is no accident. It is the result of in-depth research, international.
But just certified, no eligible married woman would be denied the right to vote. That should go without saying. Republicans blocked it. Let me repeat.
Okay, she's silent. It is a Data Saves Lives is the result of in-depth research, international exchange, and my commitment is to making things for patients and citizens better. Therefore, we don't want to replace roles or whatever. We want to build bridges. This is important, but that requires substance, and that's what we bring to the table. The Kompass, from an idea to a magazine. The idea became in last year, very early, but I was at the Health Tech conference in Munich. And I was invited to attend at a panel with experts, and as always, so people who know me know I'm always asking for, can we have please better communication? Can you share your knowledge, please? Because we need to understand what's going on. And one of those experts came in and said, how can we reach people with this knowledge? How should we share that? And this was my starting signal for the Kompass. I wanted to have a comprehensive, accessible, and diverse project with the goal providing orientation in the digital health world for patients, experts, and also citizens. What we didn't want, and this was very clear in the beginning, a typical trade journal developed exclusively with experts. What we wanted was a navigation tool for the flood of information to support patients, citizens, and patient organizations, and also to bring the perspectives together. Means also, again, patients, experts, but also research and politics. Because communication is a central theme. And how do we really reach people? What is necessary? That was the question in the beginning. And the mission was clear. It was strengthening health literacy, making knowledge understandable, not just passing it on, and building trust in digitalization and health data. This is one of the big pictures we have here. These are all the authors we have around the Kompass and who helped us. And some of those faces are in the panel afterwards. You can see them then. Some numbers and facts about Data Saves Lives. We had 739 posts organically shared through our channels, around 1,200 clicks on our info center at the Deutsche Ärzteblatt. The Deutsche Ärzteblatt is a magazine more for HCPs, and yeah, we're very proud because they give us support in offering us to use it for free and also spread the word, and it's a very successful thing what we have. I attended in 25 events across Europe, for example, at the OECD, then at the DMEA. DMEA is one of the Europe greatest digital health congresses we have in Berlin. I also attended as mentor at the hackathon in Munich. I was at the DigiHealth Day in Deckendorf in Pfarrkirchen at the Digital Institute of Technology. So Professor Georgi Chaltikyan is also on the line here today. He's leading this. And I did a lot of workshops, speeches, and presentations. For Data Saves Lives, we offered 5 online sessions. We have the new funder, the Bosch Health Campus, and we are proud about it. And last but not least, I received in November a fantastic award. This is the Healthcare Frauen, the Healthcare Women. This is the Women's Association coming from healthcare in Germany. And I received the Female Transformers in Healthcare Award in the category Voluntary Work or Engagement. So now let's come to some insights. We did an analysis. It's not representative, but we have big ears, and we listened to the patient communities, and also we did interviews and discussions with them. One of it is almost 60% of participants feel well informed about the healthcare system, And we can say, and we had that in the German session before, this is mostly patients because they are directly affected by a disease and now they have the struggles and they have to, yeah, I would say deal with the challenges a healthcare system can bring in. A quarter feel that they are insufficiently informed, and 16% said we are not informed. Mostly that, and we can see that from the statistics, the 16% are healthy people, so they have not so much touch points to the people living with chronic or long-term diseases. 75% of participants actively inform themselves about digitalization and health data. So there is an interest, and this is, I would say, momentum we should use. Mostly they do this online. Some of them ask their doctors, but this is a problem because doctors have not enough time to clarify all those questions around digital health and health data. So this is a hurdle, I would say, or a challenge. And so people feel not often very good informed also because of this lack of time. They say information is not really good to find. There is a lack of campaigns. They feel they see unclear explanations. They don't understand everything. One example, what we had in Germany is the electronic health record. This was a little bit of a not so good presentation, I would say, in the big picture, because people feel not informed about it very good. Let me mention today the big rollout of the electronic health record called EPA has started. So we will see how things going on now. When it comes to digitalization in the healthcare sector, over the half of respondents rarely hear anything and see a great need for improvement in communication. And maybe you can see communication is the big thing. 10% do not feel informed at all. The remaining respondents in our questionnaire understand at least some of the information already. This is very easy to explain. We are surrounded by digital tools in our cars with a smartphone, whatever. So there is an understanding there, but not really deep when it comes to digital health or health data. All respondents have said that they would like to have more security in the protection of health data, and this is also an ongoing theme we always find, and it's always a challenge, and I guess we need some time more to clarify that and find a final result. Some insights what we can in communication requests that we can clearly identify is we need comprehensive, accessible information. We also need trustworthy sources. We need dialogue formats, different formats, means events, online sessions, the direct contact. This was also a result what we heard before. It's the face-to-face contact what people want to have, especially when they have questions or issues to solve. One of the positive things I want to mention is the project Healthcare by Your Side. Data Saves Lives is also in their ad board, and this is the test region in Franconia. That means they had to test the electronic health record file during the last, I would say, 5 months. And they had local events, they offered online meetings, and also they give flyers and also information out to inform the people a bit better. What we also see, there is a willingness to accept changes if there is a noticeable improvement in quality. Digital tools are hardly known, especially among the older target groups. This is not always clear, but also people who are not digitally savvy or cannot afford a smartphone, this can be a struggle. And we have to see that we face that challenge and don't leave them behind. And I think there are really realistic chances to bring them on board. Barriers, lack of technology, concerns about data protection, as I said. There is the desire for personal contact, and also contact persons are important, especially when something does not work. A recommendation was also use younger people as multipliers. make targeted use of social media. This can also help, especially the young people are really interested. But we also have to take care about them when it comes to share content, that the content is correctly and understandable for the communities they have in their on their social media accounts. What was really a great pleasure for me is Data Saves Lives Germany was cited as a very trustworthy source, and it showed that we are doing something right, I guess. So it was a really great thing to hear that, and also to see that in our analysis that we are really seen as a partner and not just as a, I don't know, organization. What else we have done is we did a literature review of various recent studies about digital health literacy, and just 3 results. Many difficulties with digital health information. This is a health literacy survey in Germany. There's a lack of trust in applications. This is the BMC study. It's Bundesverband Managed Care 2024. There is a need for clear communication in data protection and also to know more about the benefits. Other studies we also have researched is Robert Koch Institute's Kompass, the study about health literacy from the Carium Foundation in Switzerland. As I said, the Bundesverband Managed Care, BMC, also the World Health Organization and the OECD. This brings me to our recommendations in brief. You can read it more deep in our magazine. Strengthen communication and cooperation with patients, patient organizations and citizens. Promote digital data and health literacy and embed education as early as possible. Establish participation and quality assurance. And here we recommend a digital advisory board installed in the government to make sure that patients and citizens are heard. Also strengthen innovation and trust. Trust is something we hear all the time, also in the political scene. Politicians always, I would say, complain sometimes a little bit, saying, okay, we need more trust. And also grow the reach and do community building, because I think when we build a big community, bring people on board, we can move forward more easily, and I would say also more informed. So, and this is my big thank you. You can see our ad board. I just call them by their names. This is Eva, Benjamin, Rainer, Sylvia, Martin is here in our call, Ulf, and the wonderful Louise, who is our moderator for today. I also want to say that our agency we had from Munich Lucky You was involved very heavily in the design and also in the layouting, and also helping us to find solutions for some questions, especially Tanya, Christoph, and Bianca. And I want to say thank you to everyone who is actively supporting Data Saves Lives, because they believe in our project. Also, thank you to everyone who shares knowledge with us, also works behind the scenes to keep things running, and also support Data Saves Lives as a partner. If you would like to sponsor or support us in any way, please get in touch. We are open-minded for discussions, and we look forward to hearing from you. And now I give back to the wonderful Louise for our great discussion.
Thank you very much, Birgit. And I think, first of all, congratulations to you for putting together the Kompass, more or less single-handedly, and motivating all the authors to produce their inputs. I think you can be very, very proud of what you've managed to achieve. And I'm very, very proud that the Bosch Health Campus can be a very, very small part of that. So congratulations and well done. I'm going to move on to the discussion now. So we have a number of authors who have joined us today. We would like the discussion to be interactive. So please do feel free to post your questions either in the chat or raise your hand. Don't hold back. And while you're thinking about maybe something that you'd like to pose to the group or to one of our panelists, I'm going to start off with Professor Opitz, one of the authors or one of the contributors to the magazine, who in the magazine quite clearly said that digital health literacy is a key prerequisite for the successful digital transformation of the healthcare system. So, Professor Orpitz, perhaps you could maybe let us know how you define digital health literacy in everyday clinical practice.
Yeah, I surely can do that. Thanks for inviting me for that beautiful afternoon discussion. So let me start with a broader comment. Digital tools and AI have the enormous potential to really make healthcare processes more efficient. And finally, provides healthcare providers with what they do best, taking care of patients. So the question is why we don't see that potential in our daily life? Why is the implementation of digital tools and AI so difficult? And one reason is the lack of acceptance. And we all want to use things we're accustomed to. And the same is true in the healthcare sector. So you need to strengthen the digital competencies of all stakeholders in healthcare to really fulfill the potential digital tools have. And we developed a lot of formats to strengthen digital health literacy and competencies, especially targeting multipliers within the healthcare providers, but also in the general populations. So we approach them with, for example, digital health trucks or showrooms where they can touch and feel how the healthcare system of the future would look like, and to see that the technologies do work. And with that, if people experience by themselves how things work, they start to recognize the advantages and start to use them. So it's a continuous process to use multipliers to really reach all the stakeholders in healthcare system, that we get used to use new technologies as we use the smartphone in our daily life. 20 years ago, no one would have been able to use a smartphone. Right now, I think this is the most important medical product, and regardless of age, everybody can use that, and the same should be true for digital tools in the healthcare system. You have to bring it to the people and show and accompany the implementation of these new tools, and then the acceptance and the usage gets better and better.
Thank you, Professor Orpitz, for your insights. I'd like to now move to a patient perspective. And Judith Safford is somebody who has a number of different hats: researcher, consultant, but is also a patient expert as well. What is it that you need, Judith, so that you feel well informed and taken seriously? And could you identify, did you find those things being addressed in the Kompass? You're on mute. The classic.
Thanks very much for this invitation. Yeah, I can very much connect to what Professor Opitz has just said. You have to meet me where I am for me to use it, and everybody has different places where they are. And as Professor Opitz rightly said, everybody can use a phone, a mobile phone, but many of us use them in very different ways. So as an analogy, some people are really good, and some people use some things and haven't realized about other things, and perhaps get shown by their children, or maybe in medical you could be shown by your healthcare professional. But digital literacy and the willingness to use digital health technologies do vary from person to person, and citizens can learn, but you have to meet them where they are first, and then go from there, I think. And as we've seen, you can use a mobile phone, so I'm sure we can we can master the digital health technology in useful ways. And if there are some people that can't master it, okay, we still have a paper option, for instance. Yeah.
Thanks, Judith.
What was your second point?
Thank you. Yeah, absolutely fantastic. Thank you. I'd like to speak to or ask a question to Professor Scholz now. The word trust has been mentioned a number of times in Birgit's presentation, and I think the theme of trust is sort of underlying to also the inputs that we've just heard from Professor Orpitz and from Judith Stafford. So how do you think we can promote true interaction and build trust between professionals and patients so they both feel that they are equal and in partnership?
Yeah, thanks, Louise. As Birgit said, you introduced the Healthcare Biocycle project, and we had the honor, I would say, to accompany this project from a research perspective, and that's what we actually asked also the population in our region for that pilot project. So what can help the people to actually trust also in digital health applications like the EPA as soon as they know something about. So Birgit also mentioned about several communications, and trust is something we found is one of the main enabler in these acceptance of new digital health applications. And trust is also something that can be built, for example, by really building up relationships, showing empathy, and showing that you understand where the patients stand. So what Judith said prior, you have to pick them up where they are. So showing a real interest in what patients are concerned about, for example, or what they really want to know, that they have the impression that they actually are important to the system. So that not only includes the healthcare professionals, but trust is also built by politicians talking about digitalization in healthcare. And as soon as you see that you are seen and people try to understand, that doesn't mean that they have to know perfectly about your needs and your concerns, but they have to show a true interest. And this can only be shown, but this is my personal opinion, that's nothing we asked in the survey, by really showing the trust by talking to people, asking them, what do you care about? What are your concerns? What is important to you when it comes to your health and when it comes to fostering healthcare by implementation of digital tools? So these are just some insights, but also my personal opinion around this research project when it comes to trust building.
Thank you, Stephanie. In the chat, you can find a link to the project that Stephanie was just referring to, Healthcare by Your Side. Professor Chaltikian, welcome, and from Copenhagen. I'm glad to see that you've managed to find a quiet place where you could join us. In the magazine, you mentioned your 10P health and well-being plan. Perhaps you could maybe just briefly describe what you mean by that and how you think this could be introduced to Germany. What needs to be done?
Thank you very much. I hope I'm well audible. I can I can see that I am.
Yeah.
First and foremost, congratulations to everyone on the launch of Data Saves Lives Germany Kompass. Congratulations to Birgit, to you first and foremost. Congratulations to all the contributors, and many thanks for inviting me to contribute to that landmark, I should say, publication, and to be part of this amazing event. Indeed, Louise, thanks for mentioning what I like to call 10P health, or a digital precision health. And this is what I have tried to shed light a little bit in my contribution to Data Saves Lives Germany Kompass. And this is indeed an approach to a revolutionary change in how we manage health and wellness based on digital health and digital technology. And what is especially important in this approach with regard to and in relation to today's event is that this is all about putting a person, a citizen, or a patient in the seat of the pilot of their own health and wellness. The approach is essentially takes on the precision health or participatory health, or what the person, the expert, the amazing scientist and inventor, whom I consider to be the founding father of this approach, Dr. Lee Hood, or Leroy Hood from the US. He was the first one to introduce the concept of P4 medicine, and P4 in relates to predictive, preventive, personalized, and participatory. I just, went ahead and rounded up these 4P to 10 Ps, adding a few more words starting in P, like pertinent, pervasive, permanent, and platform-based, and so on. But the essence of the approach is, as has been described by Dr. Liud, it is grounded in continuous collection of digital data of every person, and making these data available to modern AI algorithms, AI models, to be able to predict and prevent essentially illness, or if illness comes to the stage of development, to be able to provide the best care for a person. And this is an approach that we believe is going to be the true 21st century health, fitness, wellness approach that is going to essentially revolutionize our societies.
Sorry, I couldn't find the unmute button. Thank you for that, Professor Chaltichian. And I'm really pleased that Data Saves Lives Germany and the Kompass is going to help you implement that vision. So it's very exciting, and we look forward to hearing more about that sort of sooner. I'm going to be a bit unkind now, and I hope it's okay, Sheila, if I ask you a question. You mentioned in the chat before that you remember having conversations with Birgit a while ago about Data Saves Lives Germany and the magazine and so on. So I'd just like to ask you, why do you think that it's taken Birgit to be the one to do this Kompass, to do Data Saves Lives Germany? Why hasn't anybody thought of doing it before? Everybody seems to think it's a great idea. Everyone seems to think it's necessary, but we had to wait for Birgit, and luckily we have Birgit, to be the one to actually, do it.
Well, it's something I think we can all relate to. It's easier said than done, right? It's easier to sit here and say, oh yeah, we need it, oh, it's fantastic, what a great idea. But when it really comes down to sitting down and say, okay, now let's talk business, the room sort of empties out. And as long as I've known Birgit, nothing has ever stopped her. She's a very determined woman, friend, And when she sets her mind on something, it's like move out of the way. And she's really good at when she speaks, she's an expert. She doesn't speak out loud just like for no reason. She has very valid points. And even though I'm not in Germany, I understand, and she's always been fighting for this digital awareness and literacy, and so I absolutely commend her, and I wish I had the guts she has, basically.
Okay, thank you very much. So I'd like to maybe open the discussion up to others in the room as well. I see we've got a number of different sectors represented through our participants. I'm just looking at the chat as well. So it'd be really great to maybe hear from your experiences. I'm assuming you've all read the Kompass either in German or in English. What was the bit that inspired you? Is there anything that you think was maybe missing? It'd be great to get some feedback, I think, from the group if possible. Is somebody going to be brave enough to put their hand up and and contribute?
I think, Louise,
Yeah,
they still wait for, I don't know,
Bronwyn's just raised her hand.
Bronwyn now, yeah.
Bronwyn, the floor is yours.
You can count on the Canadian to put their hand up if there's a silence to avoid the awkward silence. I think this is just exactly what we need to raise the level of the ocean for all the people where they're at. I love that point that Judith made, to take us one step closer to the future that we've been describing here. And we did a thought exercise a few years ago to try and imagine what the patient or the person of the future might look like, the empowered person of the future might look like. And one of the things that was important was that that person wants to have an understanding and be able to use their healthcare data. And to do that, they need to have both health and data literacy. But to the point in the chat, one of the other aspects that we thought this person of the future who's empowered would want is to own their healthcare data. And I'm just looking up to see, and that they'll demand data security and transferability, and that they'll be able to use that as their own personal equity. So I love this comment as well from Judith here about data and use and ownership. And I think we're just, I don't know, at the beginning. Are we at the beginning? Maybe we're somewhere in the middle, but there's just so much more room to improve our understanding, which will also then improve health outcomes, because that's what it all comes down to, right? Being more literate translates into better health outcomes. And that's what we all want, whether we're people living with disease, whether we're healthcare systems, or, you know, whether we're a pharmaceutical company. We want better health outcomes. So great topic. And thank you, Birgit, for your leadership here.
Thank you, Bronwyn, as well, for those really great insights. And then I'm going to come back to you, Judith, because you put in the chat, you know, the topic of trust, something that was also clearly mentioned in Ilona Kitbush's contribution, and something that, you know, Bronwyn has very clearly mentioned as well. Maybe you'd like to take a few words on that from a patient perspective, but also maybe from a researcher's perspective.
So that the question kind of came up. I worked for 3.5 years as director of a national registry for rheumatic diseases, and I'm a patient with inflammatory arthritis. And I was putting in my data every month, and then the registry was selling the data. And it was like, my compensation is that maybe we'll find better treatments but not for you because it takes too long, but for my children. And I just thought there's a fundamental injustice there. And yeah, I still do it because I believe in it, but kind of a bit begrudgingly. And I wonder whether, as Professor Kitbush has brought this up as one of 3 crucial points, and I've really never seen it discussed. I wonder whether there is there are possibilities to think about. Would it increase trust if patients really owned their data, and Bronwyn has said very clearly, yes, but how does it actually happen? You know, we have ideas of people's capitalism where in the UK, the John Lewis Partnership employees own the company, kind of shareholders. What about the same model for data? And I own my data, and the dividends in some way come to me. Yeah, those are sort of visions I have, but maybe I'm taking it too far right now. But just the idea, how are we going to do it? How are we going to do it that patients own their data?
Who's got the answer, or who's got an idea that they'd like to share?
Or if that's too difficult, then would it really increase trust? Do we really believe that?
The question is, I think, so what I know from our previous work and also from our Data Saves Lives Shiplog magazine #1, the big one. This was one of the big questions what we had at this time. And what I can say is that we have tried to find it out, but what we heard is from many people living with chronic diseases saying, I want to have back something. It's not just giving my data to something, so give me something back, maybe in form of an incentive. And I was I would say, I was a bit cheeky because I went to the government, said, hey, if we give our data, please make sure that people use the data for their research and for whatever they want to have. Please make sure that they receive the outcome of the analyze much earlier than maybe in 20 years, because in 20 years I don't need it anymore, maybe, or probably. This is one thing. And the other thing was, I said, give them the opportunity to learn. So share the knowledge, help them to learn, to grow their health literacy. So maybe make an academia foundation or whatever to give something like an incentive back to the patients as the data owner. And also bring them back from the, I would say, a little bit of a desert of, I don't know, to the level of, hey, I'm informed and I can make the decision. So I give you my data. Please give me the information to be informed and make better decision, means also a better outcome for my quality of life. This could be one option, just my private opinion. But this is an ongoing learning what I'm having here.
But what I'm also hearing, though, is also, I think, what we would call transparency. And I think being able to sort of avoid conflicts of interest and actually being known from the forefront what your data is being used for and why, so that you can decide if you want to be part of that or not. So what I'm hearing from you, Judith, is that, you know, you were feeding your data into a registry. And if they told you up front, you know, we're actually selling your data, you as you said now, you still feed into that data, but you didn't feel that you were being informed of all the consequences and all. Well, it wasn't transparent. It wasn't a transparent process, so you felt lied to, maybe. And I think transparency goes a long way to providing or building trust, and is sometimes something that's sort of overlooked in terms of conflicts of interest and so on. I don't necessarily think it's a conflict of interest that is necessarily the problem. It's the fact that it's not been declared, and that declaring conflicts of interest or commercial interests would then go to building trust through being transparent, so that the person is actually able to decide with the full picture of how they want to share their data. Georgie, I saw that your hand was up, but it's been taken down. Was that deliberate because I was talking too long, or?
No, perfectly fine. Perfectly fine.
Okay.
Well, what I wanted to say, and thank you, Judith, for bringing this up, the issue of data ownership. Well, as of today, there has been a lot has been said about patient or citizen being the owner of their data, but we know that this is far from being the case. Absolutely. And I just wanted to make the point that with this vision of platform-based personalized preventive care, we should be moving towards people actually holding their data and having control of their health data. And that is going to be pretty much facilitated by the fact that we're going to have more and more health data sources that are under direct control of the citizens, of the people. I don't even like, calling them patients any longer. If you, I mean, those who have followed my conversations or my public appearances probably have noticed that I don't use the word patient any longer. I don't use it a lot, because this vision of 10p health, this vision of digital precision health, it's about essentially all of us. We don't need to be patient any longer in order to benefit from this approach. And the more we go, the more digital transformation happens to our lives, digital health transformation, the more sources of health data are under our direct control. Like, for example, all these sensors, right? The less will be the share of data coming from healthcare providers. With all due respect, I'm myself stemming from healthcare provider side. I worked for 20 years as a medical doctor, as a healthcare professional. However, this is an absolutely inevitable trend, ladies and gentlemen. We're going to have more and more health data independent from brick and mortar healthcare providers, from brick and mortar hospitals. We're going to have more and more health data coming from sources other than healthcare professionals. Right now, I am contributing and participating in a conference on health workforce, on the future of health workforce at UN City. And there has been an amazing, comment. A person, one of the colleagues, in one of the questions or comments at the plenary, he just, stood up and he said, well, come on, we are already past the first quarter of the 21st century, and we're still speaking doctors and nurses, which is 18th, 19th, okay, 20th century, but definitely not the 21st century, ladies and gentlemen. And as I made it very clear in my intervention at the panel that I participated, well, 5 years from now, but probably not exactly, but definitely 10 to 20 years from now, whatever we speak to today about doctors and nurses might not be relevant any longer. A lot of things are going to change, and part of this transformation, and a huge part of this transformation, of this revolution, is that we, the people, are going to indeed behold and own our health data that is going to be provided or produced by a lot more than just, doctors and nurses of the 19th or 20th century.
Thank you. I think there's a lot of positive resonance about your input there, and it goes very well with a question that we've got in the chat. Unfortunately, we're literally at the end of the session, but this is something for you to take home to think about. So this has been posed by Peter van Galen. If the patient owns their data and it has a value, what would happen when that person dies? Who inherits their data? And will taxes have to be paid? And it's almost as if, the problem isn't getting easier, it's getting more complicated. But I mean, it's absolutely, it's a very, very valid question. Sadly, we've only got 2 minutes left in the session. I appreciate it is a Tuesday evening. So I'm going to wrap up the session and say thank you very much to all our panelists and authors, but also for you for joining us this evening. I'm going to pose one last question to Birgit. In your Kompass, I think some of your parting words are, let's make health data sexy, which isn't something that you very often read in such a paper. What do you mean by it? Can you maybe give us a little bit more of an insight?
It was last year in Berlin, and I was in a workshop talking about how can we, exactly that question, how can we bring health data and health literacy to the, I would say, to the people. And it was a really interesting group because it was experts from Israel, what is much far, I would say, away from us. They are moving forward, and the German ones. It was a nice group. And everyone was really focused on how can we do it. And there was, at first it was a hotel buffet, like in an all-inclusive club hotel, the cocktail of health data and the electronic health data menu or whatever. And at the end, it was a buffet from different formats, as I said in my presentation before. So dialogues, face-to-face meetings, good communication, and so on. And at the end, and I was listening for 2 hours to them, leading just a discussion, but it was not so much work for me because they were so engaged. And then I said, so, okay, yeah, let's make health data sexy again. And if you have a look on a good data set, there is something like sexy behind, I would say. It's really interesting, and you can learn a lot from data. And maybe we should see it with a little smile in our face. Maybe we can do a little joke about it. But to make health data sexy means to motivate people to have a better look at it, to be a little bit conscious what is happening, not just seeing the bad things, seeing the good things. And I think this is what we also have to sell to the people, not saying, oh, data protection is so important and also our privacy and so on. So let the people know that there is so much behind a data set and you can learn so much from it. And you can have those experiences to help people maybe also who live with chronic diseases to make their life better, to grow the quality of life, because this could be at the end a goal or a result, and this is what we all want. All right.
And with that, you've now got your homework. You know what you've got to do. Please feel free to carry the discussion on social media, on the DSDE blog, LinkedIn, Instagram, and so on. We need to get the movement. Need the movement to continue to move and to grow. So we would thank you for your enthusiasm and for helping us to do that. And on that note, I'm going to thank you all. Have a lovely evening, everybody, and thank you for joining us. Take care and bye-bye.